Substance use disorder is a medical condition that is characterized by difficulty with making decisions, usually tied to substance use that is excessive in some way, whether somebody's spending more time trying to find the substance they want to use, using more than they had initially intended, using that substance in dangerous conditions. So there's about 12 diagnostic categories. It needs to be recognized and treated as a medical problem, not as a moral failing or anything like that. When we look at all substance use disorders, alcohol use disorder is probably evenly distributed throughout the northern Minnesota counties. When we look at numbers of people with opioid use disorder, Minnesota ranks on the low end. But some of our counties in this area are on the high end, even nationally, in terms of the rate that they have for opioid use disorders. We have seen 3 phases. The initial phase of opioid use disorder was in regards to prescriptions provided by physicians and taken by patients where they used too much for too long and developed an opioid use disorder. Then the population moved from prescription pain medicines to heroin because it was cheap and often used illicitly. Then the era of fentanyl, because fentanyl again became even cheaper than heroin, was easily made and brought into the United States and extremely potent, which led to a bunch of overdose deaths. And just in the last year and a half or 2, we've seen that curve kind of plateau and now come down a little bit, probably I think because of the ubiquitous availability of Narcan. The reason they're continuing to use is to prevent that withdrawal. They don't really are seeking to get high anymore. It's just to prevent withdrawal. And buprenorphine or methadone can take away that withdrawal without getting people high and give them an even keel so that their brain can heal and they can get better. Give them room to do the things that they need to do rather than continuing to struggle. And so it's really, number 1, life-saving medicine, and number 2, people really get a chance to get their life back. I think we have really built up a lot of programs in Northern Minnesota Wellness Addiction Center. The Recovery Medicine Clinic takes care of a lot of people. We have Oshki Manitou, which is a treatment center. We have Face It Together, which is a peer support group. We have a treatment program in Park Rapids with the Recovery Medicine Clinic. If an unborn child has been exposed to many different substances, neonatal opioid withdrawal syndrome, and OWS, and NAS is neonatal abstinence syndrome. And so even if you're abstinent from an SSRI, an antidepressant, or tobacco, or other substances like alcohol, in addition to opioids, you'll have some withdrawal syndrome. And so it's a really general term. And what we're seeing a lot of recently in the last 5-6 years is neonatal opioid withdrawal syndrome, which is just specific to opioids. But when you have neonatal abstinence syndrome, and it includes opioids and an SSRI, you sleep, eat, and console, which is making certain the baby has plenty to eat, that the baby has a quiet, dark environment where they can sleep and not be so stimulated because they're in withdrawal. And then using some form of swaddling or cuddling or that kind of thing to help reduce those symptoms. We've learned a lot about how to treat neonatal abstinence syndrome, and so those babies go home with mom. We get mom into treatment either during her pregnancy or at the time of delivery. We really worked hard with social services, our care managers, to reduce stigma and to have a very non-judgmental atmosphere. And so it's a really worthwhile thing that we're doing. Referrals to ongoing treatment and early childhood and family education and all those sorts of things to help these families thrive. From a family perspective, many families get back together again, mothers, children, spouses. People get jobs again where they previously didn't have one. And so communities really benefit. The more that we can get people into recovery and not using it will make it less dangerous for other people in the community. One thing that I think really helps people who have opioid use disorder, they've experienced all kinds of bias and discrimination really because of historical opinions about substance use disorders, that if you were just stronger or a better person and just quit doing that, you'd be much better off. And what we've learned is you can't tell a person with hypertension, just make your blood pressure normal. Or somebody who has a broken leg, well, just walk on it, it'll get better. We need to provide the treatment for the problem that they have. And now we have some really good treatments for that disorder. And it's not because those people are poor or weak or have some moral failing. It's because they have a disorder. We need to meet those patients where they are and do harm reduction and provide invitations to treatment and help them with whatever medicines that we have available. And so I think that our ability to get rid of the stigma that people have around substance use disorders would allow them to come into the community in a more honest way, and so get much more traction with people wanting to seek treatment or recover from a substance use disorder when we make it not about the person, it's about the illness.
A substance use disorder, there's the popular opinion amongst people that say it's a choice. And then there's the medical definitions that say it's a disease, whatever they've been through throughout their life. There's a number of different reasons that people could choose to use to mask what they're really going through. Resources in the community. Here at Red Lake Chemical Health Programs, we have a number of different programs. We have the Residential Treatment Center, Northern Winds. We have a halfway house at the same location. For youth, we have an adolescent group home. We have Warrior Down, that's our new peer recovery program. We have Red Lake Outpatient, Panema Outpatient, Pregnant Women and Families, MARS, Medication Assisted Recovery Services, DAP, that's another youth program. So that's 9 programs that we have under our umbrella. But throughout the community, we have Oshki Majitata. That's kind of like our county building on the reservation here. You can go there for services like SNAP, GA, things like that. I think they have TANF 477. They have a tarot program. And then we have Bimendwa, used to be FCS. They offer services too for families that struggle with addictions, maybe struggle with other things. They have case managers that work with families to try to keep families together. The support system in the recovery community, that's what we're trying to do here, is we're trying to build a recovery community. White Bison is a 12-step program. They say in the White Bison material that if there's no support, then they're falling right back into the same stuff. It's a cultural approach. Warrior Down used to be a thing here in Red Lake that was developed for youth. It was ran out of Chemical Health, focused on taking 8 males, 8 female students per year from the high school, getting them trained, and then their classmates and peers could reach out to them when they were struggling with anything academically, socially, at home. The idea of it is that when people are struggling, we want to be there to help pick them up. And I believe with the addictions that we're struggling with now, it's a perfect program because it's based on peer recovery services that don't necessarily make you come to a group and you have to do this work. You can come and you can meet with recovery coach, peer recovery specialist for how many ever units you need per day and develop your own path. The coach isn't going to sit here and tell you this is what you got to do. They're going to work with you and say, how do you want to do it? And they're going to be there walking with you, trying to help you accomplish your goals and just not show any kind of stigmatizing languages, any kind of shaming. They're going to be there regardless. If you fall, they're going to be there to help you pick it up. You know, what happened, how do we do things different, just to keep moving forward. They offer support groups every night of the week, Monday through Friday. That's been a huge thing in the community. But I have something like that where people can come and feel supported and talk about their struggles amongst other people that are going through the same or similar situations. It's a huge thing for anybody in early recovery. Culture plays a big role, just for the fact that as Native Americans, the culture was stripped from us. Just being able to practice our culture is a huge thing. It really gives people the chance to find who they are. There's a number of people in the community that run sweat lodges. I think it's healing because we're so used to everything that we do that's non-culture related. If you really get into listening to our Anishinaabe creation story, it talks about like we're spiritual people. So we are really just spirits trapped inside our body, you know, like this is our vessel to experience life on this planet. Without this vessel, we're just a spirit. And I think that when we get around our cultural ceremonies and cultural activities, our spirit gets a chance to thrive. It's not being watered down by everything else that's out here. Support groups and everything like that, that's open to anybody. Bemidji comes up here sometimes. Our groups, they traveled around the state, getting into recovery and seeing that, you know, recovery isn't all about the hard work all the time. There's a lot of work that goes into healing and recovery, but, you know, you got to balance it with fun too, you know, and that's what Sober Squad was the, you know, the fellowship piece that people need just to develop those connections with other people where they don't have to feel shame or guilt with the stigma of addictions. I think the first step comes from within, just to acknowledge that there is an issue and that issue is causing problems in a person's life. And then I believe the next step is to actually reach out to whoever they feel comfortable with. You know, anybody that walks in, we just try to give them a helping hand. Any kind of services you're looking for, if we don't provide it, we try to find it for you. When we get referrals for pregnant women, they're top priority. You know, it doesn't matter how far along they are in their pregnancy, they're top priority no matter what. There's usually a bed available. I know at the MARS program, we keep designated spots open for pregnant women just to help with the withdrawal symptoms so the baby's not being affected through the medication-assisted treatment. So there's a lot of positive things that come out of recovery. Family's a big one. You get your family back, you know, you start learning new skills, you get employment, maybe start school. It's an endless possibility. I'm a big advocate for harm reduction. So I would say if you want to know how you should treat somebody struggling with an addiction, I'd say take a look in the mirror and tell me how you would want to feel about yourself or people to feel about you. People deserve the same respect as you or I. We're all human beings. We're no different. What I tell people that I deal with is, you know, I'm still new to this. And I'm going to be new to it every day going forward because I don't know what today's going to bring. I don't know what tomorrow's going to bring. But I know that I'm a human being and I know that I deserve respect and love just like the next person.